often come in complaining of flashes and floaters. It essentially is a condensation of material inside the eye that people are seeing. And in a rare case, it can cause a serious problem to the eye. This is the normal human eye. This is the cornea. Directly behind that is what we call the vitreous cavity, kind of like a water balloon that's sitting in the inner cavity of the eye. That works as a shock absorber throughout our lives. But at some point in our lives, that water balloon can break. And when it breaks, we start seeing floaters. So the water balloon shrinks down and the material condenses within the water balloon and casts a shadow on the eye, and people see those as floaters. The flashes are caused by these micro adhesions to the wall of the eye or the retina, and in a rare case, it will actually tear a hole in the retina, and that is the dangerous part. It's usually a nuisance. In most cases, it's just bothersome. There are some new technologies that we incorporate in our office to use, where we use a special YAG laser to break up floaters when they're very large and visually frustrating. But there is really nothing to do unless the floaters are really severe. YAG vitreolysis is a newer procedure, and is a special laser made by a company called LX. And the laser allows us to actually disintegrate or shrink down the size of floaters. So imagine a floater that's like looking at a quarter in your vision. You can actually break it down into particles that maybe make it smaller, like a dime or even smaller than a dime. So the whole idea of floaters is not to get rid of them completely, but to minimize their impact. Most people who have floaters just live with them and tolerate them. Some people, especially people who've had surgery in the past, will choose to use the laser to minimize the size of their floaters, and there's virtually no downtime from it. It may require 2 or 3 treatments, and each treatment takes about 10 or 15 minutes, but at the end, we can actually demonstrate and see on examination how much smaller we've made the floaters and how much we've improved the capacity of the patient who has it. There is no pain with the laser, although it is a procedure, so people are sometimes a little wigged out by the concept of having a laser on their eye. There is really no way to prevent issues associated with flashes and floaters. It's just the natural change of the human anatomy. The most important thing is to determine whether or not you are at high risk for a tear in the retina. So if you develop flashing lights and or new floaters, it's worth having your eyes examined to make sure that you're not in that small minority of people who actually tear their retina doing that. And then, but once we do the laser, take the contact lens out, we give you some eye drops, and 10 or 15 minutes later, you're driving yourself home.